Yes, welcome everyone. Do we have sound? Let me check if everything is fine. So, of course, it works better if I unmute it. Right. Yes, okay, we are there. Sound is there, everything is fine. And let me just say welcome to everybody and welcome to our rather, this is actually our second open mic. We had one sometime back, and it's good to have another one. As you all know, Oral Pathology 360 is really all about democratizing education. And of course, as a part of that also comes democratizing professional development, which is why we felt that there should be another way besides someone suggesting your name. There should be another way where you get to be a conference speaker if you're that good. And therefore, this whole event. I do hope that it will be really enjoyed by everyone. I hope all of you will take really good interest and participate. Thank you for joining us. Let me give you the instructions first. First and foremost is that there is a link that has already been shared on YouTube, and you would need to click on that to go and vote. But once you open it, please remember that you can only vote once on it. So if you close it, then you cannot vote again. It will register your email, and you cannot register with the same email again. So what I would suggest is either you open it and keep it open for the whole duration of the program, so you can just vote along as we go, or then what you can also do is um, you can just write down your decisions, and then once and for all at the end go and vote. The voting is very simple. It's each I've also included pictures because names may be difficult to remember. So it is with yes, no, and not sure. Very straightforward. It's about as straightforward as it can be. Also, if you are with us, I would love to know where you're from, and I would love to know your name. Also, that if you type that now in the chat, it will ensure that you are actually connected to the chat. Because remember, if you're watching the program through any of the other platforms, because I post it on Facebook, on LinkedIn, on WhatsApp, everywhere you can literally open it and watch it from there itself, but then you cannot comment from there. And there are two prizes to be given away for those who are here with us on the platform. So for that, you need to be able to comment. So please, if you are not on YouTube, well, get on YouTube, and that will ensure that you can definitely be able to vote. Another thing is, please excuse the slightly basic format of the live stream today. I've had to use Zoom due to some technical problems, and it's a little dated compared to what I regularly use. So we will not have all the abilities that we generally have, and I'm sorry for that. But it should not make a difference to the lovely presentations and the way things are. Thank you. And we already have Dr. Yoeta, Dr. Mohanty. Thank you. Yes, thank you for typing in there. So I will now just start. Our first presenter is Dr. Anita. Yes, Dr. Anita, you want to put on your mic and just introduce yourself?
Good evening, everyone. I'm Dr. Anita from Bangalore, Karnataka, India. I'm a practicing dentist, and I'm passionate about oral pathology and microbiology, particularly the research side. Thank you.
Yes. Thank you, Dr. Anita. So we have a recording because I did not want there to be a loss of the whole event just because of network. So we have a recording. We will listen to the lecture and come back.
Good evening, everyone. I am Dr. Anita, talking about oral microbiome and its role in systemic health today. The collective microbes found in the oral cavity have two main functions. They protect the body through mucosal barrier, and they prevent pathogens from adhering our body. Study about oral microbiome has evolved all through these years, and gene sequencing and metagenomics and next generation sequencing have advanced this field very much. We are able to study about the entire microbiome. The microbiome in disease is known as oral dysbiosis, and there is an imbalance in it. There is overall loss of beneficial microbes, and there is expansion of pathogenic microbes. Oral infection can contribute to systemic pathology in three ways. Either it can spread directly, or it can give its products and endotoxins, or there is an exaggerated response of human immune system to it. The oral microbiome affects the gut health through the oral gut axis. So the pathogens from oral cavity reach the gut through two ways, enteral route and hematogenous route. So what the gut does in response? There is an immune response, gut dysbiosis, and there is chronic low-grade systemic inflammation leading to inflammatory bowel diseases, chronic liver diseases, cirrhosis, and even progression to carcinoma. Carcinoma and oral microbiome, there are associations between cancers like oral cancer, colorectal, cervical, breast, gastric cancer, and the organisms have been identified and they are studied now. Through all these mechanisms, pro-inflammatory pathways, cellular proliferation pathways, and production of virulence factors and carcinogens in the microbiome, they cause cancers. And the gut health can be reversed. Dysbiosis can be reversed by using probiotics, and its anti-tumoral effects are also exploited. The Lactobacillus plantarum is one such example. And viruses and cancers are well known to be associated, and the viruses like human immunodeficiency virus, human papilloma virus, Epstein-Barr virus are known to cause human cancers. And the fungal Candida albicans, a known opportunistic pathogen, is known for its dysplastic changes in oral epithelium, either alone or through with other species in the oral cavity. Cardiovascular diseases association with oral health is well established. Atherosclerosis, periodontal pathogens, they are said to affect it directly. In Alzheimer's disease, in adverse pregnancy outcomes like preterm delivery, organisms and their products are associated. In metabolic diseases like diabetes, polycystic ovarian syndrome, subgingival gram-negative microbe shift is observed. And in autoimmune diseases, there are links between periodontitis and autoimmune diseases. And in HIV and COVID-19 viruses, all these knowledge is applied to modulate the immune system and to reduce the destructive side of the immune system. So classic therapies which apply the modulation of oral microbiome are oral hygiene measures, nutrition, and host modulation using various derivatives. Novel therapies, usage of probiotics, prebiotics, antibiotic prophylaxis, antimicrobial peptides, nanoscale drug delivery system, even oral microbiota transplant are under study level. Vaccines to S mutants, P. gingivalis are under level. So to conclude my talk, oral microbiome, they are biomarkers which can indicate early disease and predict therapeutic effect. Thank you.
Yes, thank you, Dr. Anita. And our next participant is Dr. Kushali. Okay, you can please go ahead and introduce yourself.
Okay. Good evening, everyone. I'm Dr. Kushali Shah. I'm working as a senior lecturer at KM Shah Dental College, Sumandi Vidyapit, Vadodara. I have completed my MDS from Government Dental College, Ahmedabad, and I'm very passionate about oral pathology, and I myself has selected this subject as my MDS. So, looking forward into this field. Thank you so much, ma'am.
You're most welcome. Thank you for this, for being here. Yes, now I shall share your presentation. Give me a second.
Good evening, everyone. My topic for presentation is impact of digital technologies on oral pathology. Digital dentistry has constructively evolved a lot compared to the conventional dentist, and it helps both as clinician as well as the patient in terms of the patient care. When we talk about the digital pathology, the three main modules that come is the clinical or the patient care. Most important is the research which has evolved nowadays and the education. Now, to start with the workflow, the laboratory workflow have efficiently been improvised in terms of digitalization. This will lead to an improved teaching and training, will lead to a technology development, and will cause an ease of collaboration with the various institutes, with the various reviewers, and this ultimately will lead to an ultimate better patient care. When we talk about the digitalization of the laboratory, the first thing that came is the Laboratory Information Management System, which is LIMS. This system is generated to give a unique digitalized code that we give to a particular sample, and we just follow up the sample till the it's receiving to the report generation. For this, a barcode number is generated. We just need to stick that barcode code onto the specimen, and we can just take a follow-up for where the specimen has reached. It is not only limited to histopathology. We can have this for hematology, for microbiology, for all the purpose we can use. Likewise, in this diagram, in this figure, we can see that we have used barcode sticker on tissue blocks, requisition, as well as slides on the biopsy receiving bottles. Now, once my slide is ready, we traditionally what we do is we just evaluate the slide, and if we require any expert opinion or senior's opinion, we send it for the review, and it will take further 3 to 10 days to get the reports to be printed. But if it is digitalized, we just need to scan the slide, we need to digitally store it, and we can share it to any of the person sitting at any corner, and they can review the slide within hour, and we have our report ready immediately. So this have a greater impact compared to that of the conventional slides. Now the another important feature of digitalized slide is this importance of digital storage and sharing, which is very easy to store this type of files. It can also be help as a visualization tool, and the most important feature which is helpful is the AI generated softwares and machine which we can collaborate with this digital slides, and we can use it. The another important thing is if we give a faster diagnosis, the anxiety from patient as well as his relative will be much reduced if we give a report earlier. Now the question comes is how you will scan this slide with the help of this digital scanner. Along with we have it attached microscope to it, and how we will scan is the whole slide image. This scanner will scan this whole slide. Once the image is captured, they divide it into a patches, and if we select single page, we can see that single patch, and we can see at any magnification, and the resolution is far more better compared to our routine microscope. By far, we have discussed is about the laboratory procedure, how it is held. Now, what we discuss is the education system. On the left, what we are seeing is our conventional system where our undergraduate and postgraduate students are seeing the slide using the microscopes. We know we have seen so many drawbacks while using this, but when we see on the right, which is the digitalized part, we can see every student is seeing the whole slide on their computer screen, and it is very easy from there to zoom the slide. It is very easy to scan whole the slide and to see whole the slide, to see all the structures on it. So the better it will leads to a better understanding for the student, as well as the interest in them is will be generated in future. Now, as far I have talked much about the important part that we can scan the slide easily, we can view the slide, but that is just a tip of this iceberg which we are seeing and which we need. But we don't know what is inside, what are the underlying needs that needs to be fulfilled. The underlying needs are we require 24/7 supports, we require various type of IT support, we require security traceability, we required stability. So they required a multidisciplinary approach to get this to be done. So it is always important to just see it in what all thing we require digitalization. So being a pathologist, it's our call in what sense we need to digitalize and in what sense we just need to go with the conventional one. That's it for my topic. These are my references. Thank you so much.
Thank you. It's amazing how much of content you all could manage to put into 5 minutes, and that 5 minutes has been strictly followed. This is, of course, for all the viewers wondering why these are so short. I had told everyone that 5 minutes was to be very strictly followed, and that is exactly what they have done, and I'm really very happy with that. And they've done a marvelous job. We have finished listening to two. And before we proceed, I got to remind everyone, please remember the link for the voting is there. It's pinned. It's the first comment in the chat. And also remember, you can log into that poll only once. So if you log out of it, once you finish, all you will have to go in and fill in your details. And if you do that and come out once, you cannot go back with the same details again. So best is leave the page open until you finish all the entries, or then you just note down your decision somewhere else and at the end go and enter it. The poll will be remaining open for some time after the live stream is over, naturally. So with that, and yes, I'm so happy to have so many of you here. In the meanwhile, let me just do one little bit of a okay, we will listen to the next one and then come back. So our next one is Dr. Priya Nimesh Dev. Yes, Priya, you want to introduce yourself?
Good evening, one and all. I am Dr. Priya Dev from the Department of Oral Pathology, Bharati Vidyapit Dental College and Hospital, Pune. I have completed my PhD and my area of interest is oral microbiome research.
Very nice. And this topic was really, really up your alley, wasn't it?
Yes.
Yes. But you have actually already spoken on the channel also about the topic. It's a
Yes,
very
yes.
interesting video. Yes.
When I
Okay, so
saw
let's,
that
yeah,
in the
so when,
list, I just jumped onto the opportunity to speak on it again.
good. I can see you love the topic, and that's how it should be. Okay, let me share your presentation.
Good evening, everyone. I am Dr. Priya Dev, and I'll be speaking on oral microbiome in systemic diseases. Now, what is the oral microbiome? Oral microbiome is the collective genome of all microorganisms present in the oral cavity, majority of which are bacteria, along with fungi and viruses. More than 700 species of bacteria have been identified in the oral cavity. Now, oral microbiome has been associated and linked with oral diseases. A dysbiotic oral microbiome, wherein the homeostasis of the oral microbiome is ruptured, leads to oral disease. Now, dental caries and periodontitis are the prototypical examples of a dysbiotic microbiome. Now, oral cavity is a gateway between the external environment and inside of the body. Research has shown an association between oral microbiome and systemic diseases as well, like diabetes, cardiovascular diseases, Alzheimer's disease, cancers at different sites in the body, like esophageal, pancreatic, colorectal, etc. Autoimmune diseases also oral microbiome is linked to. Now, the community composition of the subgingival microbiome in diabetic patients is differentially enriched, as research has proved it. And periodontitis is considered to be the sixth major complication of diabetes mellitus. So, a bidirectional relationship is established between diabetes and periodontitis. Cardiovascular diseases also, oral microbiome has been linked to periodontitis as considered as an important risk factors for cardiovascular diseases. In Alzheimer's disease, oral microbiome enters the central nervous system through peripheral nerves and it has been linked to Alzheimer's disease. Cancers at distant sites in the body, extraoral sites like esophageal cancer, oral bacteria are thought to be linked to these different cancers. P. gingivalis has been identified in around 61% cases of esophageal cancer and is now considered as an important biomarker. Fusobacterium from the mouth has been linked to colorectal cancers. Pancreatic cancer, also oral bacteria have been identified and are considered as high risk. It is important to note that a relationship between oral microbiome and systemic health is bidirectional, meaning systemic diseases will influence the composition and constitution of oral microbiome as well. Now, oral microbiome, which was previously a nascent industry, now is gained importance and lot of research is being added every day because the human body constitutes a major amount of microbiome and the gut microbiome, the oral microbiome, and human body is considered as more microbial than human. And with advancements in technology, with the next generation sequencing techniques coming up has revolutionized microbiome research. So previously undetected bacteria have been identified by next generation sequencing methods. This has become a game changer in microbiome research. So this is helping and will further help to develop personalized and precision medicine for targeted therapy for every patient, considering that every patient with his or her own needs is different and requires treatment which is more personalized. Microbiome research has made a technical and conceptual progress from technology driven to hypothesis driven, and sequencing technologies have helped are now focusing on a functional relationship to understand the microbiome host interactions which will help for targeted therapies. Thank you.
Rita, that was nice. Yes, all the presentations are actually very nice. And now I shall first share the details of the conference and then we shall go on. So let me see if I still remember how to do this. Right. Okay. So, as you can imagine, we are here mostly because the International Oral Diseases Case Presentation Conference in May is very close. And it is our third conference, third case presentation conference with a whole range of international partners. And one of the things you can do now is pay attention to that hashtag IODCPC24. That is what you need to type into the chat to be able to get the giveaway price of the 50% discount coupon that we are going to give away. So you can start typing it. You just have to remember what it is, IODCPC24. It has to be exactly in the same format, otherwise the system will not pick it up. Another thing is to tell you that the early bird registration is open now till the 10th of March, and that is 15% discount for everyone. Right. The things you can expect in the conference are, for those who have not been with us the last time, there will be keynotes, there will be guest lectures, there are, of course, case presentations from all of you, whoever wants to present them. These can be either single cases or they can be case series, both in the poster and the oral presentation format. And we have experts who are present who at the end will talk to you and will discuss the case with you and will comment and tell you what you could have done differently and will ask you how to do things. And basically, it's a commentary that is very amazing. And even Dr. Anita Borges the last time said it is very rare to have that kind of interaction. So it's something I hope you will join us. And then, of course, we have, like all conferences, we have discussions. There is an entire dedicated networking app, and It will allow you to identify who else is attending. You can directly send them a chat request. You can send them a message. You can interact with them and tell them that you would want to talk to them. You can even have a video conference either at that time or later. So it's quite amazing for networking. We will have technology update. We have going to have short lectures on products and technology that is the latest. And one thing is that conference is for 48 hours at a stretch. Out of that, 24 hours will be live programs, and these are broken up into sections so that irrespective of where everybody is, wherever their time zone is, they will get to be able to present and also attend some things live. Now, the last time I know some of our Indian colleagues found it odd because obviously some of the sessions were not in the time zone that was very practical for us. But then this is an entire thing for the entire global audience. It gives us an opportunity to interact with colleagues from across the globe. And anyway, all the sessions are played, replays are given during the whole presentation and also for 15 days afterwards. And the entire abstract book, the abstract ebook, will be published with an ISBN number. So it is anyway a publication, although it will not interfere with you publishing the report afterwards. And it is open for oral pathologists, oral medicine, radiology specialists, oral surgeons, dentists, head and neck pathologists, radiologists, surgeons, researchers, and students. Frankly, anybody who has an interest in the head and neck, especially oral and maxillofacial region, please share it with everyone in those fields and in those departments. And when I say it is global, I mean it's global. As you can see, our partners are from around the globe, and we have associations like ASOMP, we have other bodies like POPMA, we have the, I can never say the short form of that, the Indo-Pacific Odontology, Odontology, I can't remember that. In PAFO, I guess. And yes, and a multitude of universities from around the world. So do join us. It will be something really unique. These are the costs in case you have not checked, but please go and check on the website and see what it is like. Do join us. And with that, let me end this. And right. So that was a whole presentation on the conference. And yes, well, welcome. Our next presenter is here, and that is Dr. Krishna. And yes, do you want to introduce yourself?
Hello, everyone. I'm Dr. Krishna Sirisha, and I'm from Jaipur. Basically, I'm here as a representative of all the party lovers, party goers, party hoppers, and occasional social drinkers. So that is what I'm going to talk about today. I hope you'll like it.
Very well said. Very well said indeed. Okay, let me share the presentation.
Hello, everyone. Should we stop drinking? Today, I'm here to talk about alcohol and health. Exactly where are we? Is it a all or none, or somewhere in between? Now, the WHO says that there's no safe limit to alcohol. So hop on with me to see what we know about it. Alcohol is the most commonly misused addictive substance. It is toxic. It is psychoactive. It is a dependent causing material. But alcohol or ethanol is basically metabolized in the liver by the enzyme alcohol dehydrogenase, and it is rapidly reduced to acetaldehyde and then rapidly reduced to acetate by the acetyl dehydrogenase 2. Now, if we have large amounts of alcohol, these large amounts of alcohol, when drunk, the body cannot metabolize them faster. So, leads to accumulation of the acetaldehyde. As a result, there could be some genetic damage. Now, patients or people with mistakes in the code for acetaldehyde dehydrogenase 2 are commonly found in the Asian population. Keeping all this in mind, the International Agency for Research on Cancer, the IARC, has classified alcohol as a group 1 carcinogen. It was in January 2023 that the WHO published a statement in the Lancet Public Health when it comes to alcohol consumption that there is no safe limit when it comes to which does not affect. So there were 5 important facts that policymakers, various health professionals, and the general public needs to know to understand the link between the alcohol consumption and a range of cancers. Alcohol causes at least 7 types of cancer. This could be different for both male and female, colorectal being the most common one in men and breast being common in women. Also, we need to important that the risk of cancer also arises from the alcohol consumption. It increases from the first drink. So even low levels can lead to risk of cancer. So there's no safe limit, or no limit is safe limit. So when we come to the 4th fact, it talks about the action of tobacco or smoking and alcohol. These two act synergistically, almost multiply the effect of or the cause of cancer 5 times. When you come to the 5th point, it says that the fact about alcohol related or caused cancers all are preventable. So when we are in the age of cancer prevention, it is time to make our move and make us each and every thought counted. Now, when we come to the various methods to reduce the harmful effects of alcohol, the best by interventions that were suggested was regulate the alcohol distribution, restrict the ban on advertising, and also increase the prices. Other key interventions were involved in community level awareness to support the people who are drinking, implement drink and drive policies, provide the consumer related information on the alcohol consumers, and also regulate informal production of alcohol. When we hear all this, where are we as in our country? So once upon a time in India, it was only in 2014 any policy was actually, a white paper was taken out on the alcohol consumption in India or alcohol control. But right now, most of these action plans are not effectively having a role to play, because India lacks a concentrated and comprehensive alcohol policy, which has now posed a great challenge to addressing them. So it's time that we realize that it has to be realized. From a point of view of oral pathology, drinking alcohol can lead to a number of oral effects. Oral health problems such as tooth decay, periodontitis, halitosis, dry mouth, increased risk of facial trauma or accidental trauma. Definitely increased risk of oral cancer and oropharyngeal cancer occurs in these patients, which needs to be done. So when I come as a conclusion, I would say I may have to now agree with the WHO, with the current literature that states that there's no threshold limit where there's a switch on for the carcinogenic of alcohol present. So leave out the fake, come back to the facts, think before we drink, say no to alcohol, and cheers to life. Thank you.
Very nice. Very nicely done. And one thing though, I must say, prohibition will normally not work. What generally works is a choice. People have to make a choice. Yes, that is what is important.
Ma'am, I still represent the party goers.
To be fair, so did I most of my life. But the point is, you don't really need to drink alcohol to party and have fun. So people who know me would have remembered that I could dance the whole night. I did not need to drink to do that. You just need to be happy to do that.
So, ma'am, that is the sole reason for selecting the same topic. I mean, all others are very nice.
Yes. In fact, that is the reason I included it, because I thought it's very important that we thought about now. Yes.
And thank you, ma'am, for the opportunity. Actually, all credit to you.
Thank you. It's credit to you all for doing it. Okay, let's move on. And let me also remind everyone, I can see a lot of new people, new names, new faces, at least from the profile pictures. I'm really happy to have all of you all here. Since you are here, please do hit the subscribe button if you have not done it before. And also do hit the like for all the effort that these colleagues of ours have put in. It takes a lot to come up for any contest, I think, and it's amazing that they did it. I'm really very happy. And okay, let's go with the last one. Yes. Our last contestant is Dr. Swagatika. Where are you? Yes. Please introduce yourself.
Good evening, all the viewers of Oral Pathology 360. This is Dr. Swagatika Panda. I am working as professor in Department of Oral Pathology and Microbiology, Institute of Dental Sciences, Shiksha Anusandhan University. I believe that pathology is not just a science. It's a profound exploration that unveils the mysteries of health, paving the way for healing and understanding. So with that very short introduction on pathology, I would like to start my short lecture. Thank you, ma'am.
Welcome.
A warm evening to all the viewers. My topic for today's open mic is oral microbiome and its role in systemic diseases. We shall be discussing this topic under following headings. The oral cavity is sterile until birth, with colonization occurring soon after delivery. In adults, oral microbiota is shaped by genetic and environmental factors. Oral cavity is the reservoir of an astounding diversity of microorganisms, and here are the few pathogens and pathobionts. Oral dysbiosis is defined as any change to the composition or function in terms of abundance and diversity of resident commensal microbes. In addition to dental and periodontal diseases, it is implicated in various systemic diseases. We shall discuss those one by one. First comes cardiovascular disease. Toothbrushing and chewing lead to transient bacteremia. Another route is enteric route, by which microorganisms gain access to cardiovascular system, and the risk factors for this are malnutrition, smoking, diabetes, obesity, etc. Papyromonas gingivalis is the most important bacteria which accelerates atherosclerosis by the suggested mechanisms. Oral dysbiosis has been increasingly considered as a potential risk factor for autoimmune disease, and these are the spectrum of autoimmune diseases known to be associated with oral dysbiosis. At molecular level, molecular mimicry, autoantigen overproduction, and amplification of autoimmunity by cytokines are the potential mechanism. Translocated oral microbiota can directly interact with immune cells and contribute to the pathogenesis cellular level. Coming to central nervous system, there are two hypotheses of microbes entering into central nervous system. One is through blood-brain barrier, and the second is through its virulence factor like gingipain and outer membrane vesicles, which enter circulation to cause systemic inflammation. Alzheimer's disease is a progressive neurodegenerative disorder that is primarily characterized by beta amyloid deposition, aggregation of tau proteins, and microglial activation. Activation of microglia cells happens by cytokines released by aggregatibacter actinomycetum comitans and interaction of PAMP of P. gingivalis with PRR of microbe. Treponema pallidum facilitates beta amyloid plaque deposition, and Fusobacterium nucleatum is the one which leads to Alzheimer's disease, involving all the three mechanisms. Among three mechanisms by which oral dysbiosis leads to gastrointestinal cancer, first is microorganisms produce carcinogen like acetaldehyde, reactive oxygen species, and NBMA, etc. The second mechanism is through chronic inflammation, and the third mechanism is through regulating host cell metabolism. Diabetes and periodontal diseases have a bidirectional relationship. Diabetes patients have an exaggerated inflammatory response and increased levels of systemic pro-inflammatory cytokines. Latest systematic reviews are pointing towards a strong evidence of the association between oral dysbiosis and above described systemic diseases. However, there is a weak to moderate evidence to imply causation. Yes, we can replace dysbiosis by conventional treatment as well as regular dental prophylaxis, but use of antibiotics has to be minimized, or else it may aggravate the antibiotic resistance and disrupt the oral microbiome, causing a deeper state of dysbiosis. There is a huge scope for innovation in this field. Oral microbiome transplantation, OMT, is a novel concept of introducing health-associated oral microbiota into the oral cavity of a diseased patient to restore the ecological balance. Similarly, TNF-alpha siRNA nanomedicine target macrophages can attenuate TNF-alpha in inflammatory bowel disease. Photodynamic therapy has been explored recently to overcome antibiotic resistance. And most importantly, there should be large prospective studies which can control all associated risk factors and then can find the causal link. I'm grateful to Dr. Mandana ma'am and Oral Pathology 360 to provide me with this opportunity. Thank you so much, ma'am.
Thank you so much. And that was amazing. Yes, thank you. Now I'm going to ask all of you, please put on your cameras and let's have everybody back. Yes. And let me now try and run the giveaway as I have said I would. So you all can chat, by the way. Everybody can hear you and can see you while I get this working.
All of your presentation were superb. And Dr. Krishna, you were awesome. You were awesome in presenting your unique topic. It was really good.
Thank you, Swagatika. Same here. I was listening to, like, there's so much to work now. I have to catch hold of Dr. Priya and you then.
Yes.
Okay. Right, here we go. And here are our two winners. So that was
Dr. Manisha Das and Dr. Saurabh Bhattacharya.
Yes. Okay, I was extremely scared that I lost it. Okay. Yes, Dr. Manisha Das and Dr. Saurabh Bhattacharya. So both of you are getting a 50% off on your registration for the conference. And of course, to be able to get this, you will need to message me with your emails. And you can message me either at mandana@oralpathology360.com or at info@oralpathology360.com. Or then if you are in contact with me on any of the various social media, send me the message there. Yes. So wonderful. I must say, amazing work all of you did. It was really good. And I know you were all worried whether you will be able to fit it in 5 minutes. Did you see how much you could fit in 5 minutes?
Actually, ma'am.
True, ma'am.
Yes, it was totally amazing. I am so happy to have had you all taking part. And I don't know, I hope it was an interesting experience for you.
Yes, ma'am.
Yes.
Ma'am,
It
thank
was
you
quite
for
interesting, ma'am.
Ma'am, thank you for the providing us all these opportunities as always, ma'am, and the platform, because it is a learning experience for us also, and to hear from different speakers all over India. We are connected through these meetings only, ma'am.
Yes, exactly.
That is it's the whole wonder of it, I think, and that's what really is great. And believe me, since deep down inside there is a teacher in me. I love teaching while I was there in academics. And teaching is not only about teaching students, it is interacting with colleagues. I think you learn more than you teach on any given day. And for me, these interactions are really what gets that again back to me, and it really makes me feel very nice. So thank you. It's sort of really, really worth it. You can't even imagine how much.
Ma'am, it's a new high.
Yes, I really love being with you always. and I love having everybody there. And today we had 236 people who watched so far. So it's quite a good high for a live. And they're all here for you all. They're not here for me, they're all here for you. So I'm really happy. And yes, whichever of you joins us for the conference, as a speaker, I hope the rest of you will anyway register and attend. But to me, every one of you are good. Every one of you could easily present, be a guest lecturer at the conference.
Thank you, ma'am. Thank you.
Thank you.
Thank you so
Thank you,
much,
ma'am.
ma'am.
You're most welcome. So with that, we should say bye-bye to everybody. Yes, there have been lots of good wishes for you in the chat. You all can go and watch the video and then do the chat again. So I'm again going to request everybody watching, please hit like, just for the effort they have put in. And also, whenever you hit a like or you hit subscribe on this channel, it takes it in front of that many more people. So when we are thinking of promoting oral pathology, oral medicine, all the diagnostic sciences, then this is also one way of doing it. So thank you all. And yes, let's say bye.
Bye, ma'am. Bye.
Bye.
Bye,
See you all.
ma'am.
Bye.
Thank you, ma'am.
Thank
Bye.
you, ma'am. Bye.
Welcome. Bye.